You know, there's a very interesting finding that's just been published in the last few years. It has to do with empathy. Empathy comes in three varieties. There's cognitive empathy, understanding how the other person thinks about things. That helps a physician explain things in terms the patient will understand. Every physician needs cognitive empathy. Then there's emotional empathy. Emotional empathy is feeling or resonating with the other person. It creates rapport, a sense of chemistry. Physicians, oddly enough, may be handicapped by their own training with emotional empathy. It turns out that when most people are with someone who's feeling pain, the pain circuits in their own brain light up and activate. That means that you're resonating with their pain. Physicians, however, have brains that operate differently. There's something called the temporal parietal junction, which is a key circuit in the brain that turns off that pain resonance circuit, which is very functional, because if you have a patient who's suffering and in pain and you have to help them, you have to think very clearly. And if you're as upset as they are, it interferes with your cognitive clarity. So this mechanism is useful in a medical situation. You know, you've got to suture that wound. You've got to, you know, give that injection in the eyeball. You know, squirm-making kinds of procedures. You can't squirm. So it's very effective, and people learn this in medical school. This kicks in. The problem is if this overgeneralizes, if it means you become distant emotionally from patients all the time, because patients want a physician who is caring. They want a physician who's concerned. They want to feel rapport. That means that they trust the physician. So you need to know how to turn that on and when to turn it on and when to turn it off. So I think understanding the varieties of empathy and their active role in healthcare is very important in the medical setting, particularly for physicians.